Hi everyone, welcome back to my YouTube channel, and today we are going to talk about clinical presentation of squamous cell carcinoma. So let's start our topic with introduction. Oral squamous cell carcinoma is the most common malignant tumor of oral cavity, accounting for more than 90% of oral cancers. Its clinical presentation varies depending on the size, stage, and site of the tumor. Its early lesion may be subtle, while advanced cancers show obvious destructive features. Early clinical features of squamous cell carcinoma. Early oral squamous cell carcinoma can be asymptomatic, making detection difficult. Key early presentations include non-healing ulcers, that is a persistent ulcer that lasts more than 2 to 3 weeks. It is usually painless initially and irregular or slightly raised margin. It has granular or reddish base. Second presentation is erythroplakia or leukoplakia changes. There are red patches that are called erythroplakia, and they have high risk of transformation into squamous cell carcinoma. And they have white patches, they are called leukoplakia, and that begins to harden or ulcerate. Third feature is small exophytic or endophytic lesion. There are small nodular growth. Slight thickening or induration of mucosa is there. Fourth feature is minimal or no symptom, as there may be mild irritation, slight roughness that may be felt by the patient, and subtle burning sensation because symptoms are mild or absent and early oral squamous cell carcinoma. That's why it often goes unnoticed. Advanced clinical features of squamous cell carcinoma. As the carcinoma progresses, more obvious and alarming signs appear. First, there is ulcerative lesions that are deep, irregular ulcers with rolled, raised, and everted edges. They have hard, indurated base on palpation. Second sign is exophytic growth, that is cauliflower-like or fungating mass with irregular surfaces and that may bleed easily. It is often accompanied by secondary infection. Third feature is infiltrative growth, that is film indurated area in that tissue feels hard and fixed that may invade deeper structures such as muscle or bones. Symptoms associated with tumor progression. First is pain, that is the late symptom, but there is dull and aching pain. The pain may be sharp or radiating pain if nerves are involved. There is burning sensation. Second symptom associated with tumor progression is bleeding, that is spontaneous bleeding and it bleeds on minor trauma such as brushing. Third symptom is difficulty in function, and it depends on location of the lesion, and there may be difficulty in chewing, trouble swallowing, or pain while speaking, or there may be trismus, that is restricted mouth opening in tumors near the retromolar area or muscles of mastication. Next symptom associated with tumor progression is fetor oris, that is bad odor. It is due to necrosis or secondary infection of the lesion. Fifth feature is loose teeth in S. It indicates bone invasion and it may resemble periodontal disease. Sixth associated symptom is paresthesia or numbness, that is because of involvement of sensory nerve and it suggests aggressive local invasion. Regional spread of oral squamous cell carcinoma. Lymphatic spread is common in oral squamous cell carcinoma, and it can cause lymphadenopathy, that is enlarged cervical lymph nodes that are firm and hard in consistency. The nodes are fixed that indicate metastasis of the oral squamous cell carcinoma, and if painful nodes are there if they are infected. Second, they may spread to submandibular and jugular-digastric nodes, and they are the most commonly involved node in oral squamous cell carcinoma. Though less frequent than regional spread, advanced squamous cell carcinoma may metastasize to lungs, liver, bones, and symptom depends on the involved organ. Site-specific clinical feature. If oral squamous cell carcinoma is on the tongue on the lateral border, it can cause ulcer or exophytic mass that shows rapid progression with severe pain and difficulty in speech. If the oral squamous cell carcinoma is in the floor of the mouth, the ulcer is reddish or ulcerative lesion with high risk of early metastasis and it causes difficulty in tongue movements. If it is in the buccal mucosa, it is common in tobacco chewers and it has thickened white patch that turns ulcerated. In this case, trismus is present if spread to pterygomandibular region. And if the oral squamous cell carcinoma is in gingiva and alveolar ridge, it can mimic periodontal disease, and there may be loose teeth, gingival recession, and bone destruction associated with it. If the oral squamous cell carcinoma is on the lip, it causes a crusted ulcer on vermilion border that is often associated with sun exposure. Systemic manifestation of oral squamous cell carcinoma. Later systemic signs include weight loss, weakness, anemia, cachexia in advanced stages, and these result from chronic illness, reduced intake, and tumor burden. Conclusion of this lecture video. Clinical presentation of all squamous cell carcinoma ranges from subtle early lesion such as persistent ulcer or red patches to severe ulcerative, exophatic, or infiltrative growths in advanced diseases. Pain, bleeding, impaired function, and lymph node involvement often signal progression. Early detection is key as early oral squamous cell carcinoma is easily treatable, while advanced diseases carry significant morbidity and mortality. And this was all about squamous cell carcinoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.